What you see in this picture is a middle cranial fossa. We already discussed about the sphenoid bone. So once again, a quick revision. So in the center, you have the body of the sphenoid bone. In front, you have the lesser wing of the sphenoid bone, and just behind, you have the greater wing of the sphenoid bone. All right. Now, as I already told you, the articulations of the sphenoid bone in the previous slide, I'm not going to repeat it, but here you can see make out two articulations to the greater wing of the sphenoid. See, the major part of the greater wing of the sphenoid is articulating with the squamous part of the temporal bone here in front, and here this part is articulating with the parietal bone. A little bit here is the parietal bone, and what is remaining, that is a posterior border of the greater wing. You can see the a process of the temporal bone is pushing into this gap. Okay, here this is a petrous part of the temporal bone. So this is what you have to understand while studying the middle cranial fossa. Now let us see what are the foramens which you'll be seeing in the middle cranial fossa. Now, as we already mentioned that the olfactory nerve is seen in the anterior cranial fossa, that is the first cranial nerve is seen in the anterior cranial fossa. Now let us see the other nerves here. Now once again I'm bringing your attention to the lesser wing of the sphenoid, and this is the body of the sphenoid. So we can make out a foramen or a canal here. Here, can you see this? So between the body of the sphenoid and the lesser wing, there is a clear rounded canal called as the optic canal. So through this optic canal, your second cranial nerve, that is the optic nerve, will go into the orbital cavity on both sides. So the nerve of vision. So obviously it has to enter the eyeball, enter the orbital cavity and reach the eyeball. Okay, that's we can very well understand that. So that is cranial nerve number 2. Now what about the other cranial nerves? Let's see cranial number 3, 4 and 6. 3, 4 and 6. 3 is the oculomotor nerve, 4 is the trochlear nerve, and 6 is abducens nerve. We know all these 3 nerves are acting as motor nerves to the eyeball. So this will go like this: 3, 4 and 6. Okay, it will, this arrows 3, 4 and 6 will enter the orbital cavity through a gap between the lesser wing of sphenoid and the greater wing of sphenoid, and will enter the orbital cavity. This gap is called as a superior orbital fissure. So by and large we can understand that nerve number 2, 3, 4 and 6 has entered into the orbital cavity. And what about the next nerve? That is nerve, we have missed nerve number 5, right? That is a trigeminal nerve. What happens to trigeminal nerve? Let's see. Trigeminal nerve, as the name indicates, has 3 branches. One branch is sensory to the ophthalmic division of the trigeminal nerve, is sensory to the eyeball. So it will enter the orbital cavity. So we can put it like V1. V represents the trigeminal nerve and 1 represents ophthalmic division of the trigeminal nerve, which is also going to enter into the orbital cavity via the superior orbital fissure. Okay. Now, what about the other 2 divisions? One is the maxillary nerve, so it has to go into the maxilla. Okay, as the the term implies, maxillary nerve will go into the maxilla. So here is the foramen called foramen rotundum, into which the maxillary nerve will enter, and it will technically travel forwards, because we know maxilla is inferior to the ethmoid bone. Like this, it will go forwards into the maxilla. Next is the mandibular nerve. So this is the mandible. You can see the mandibular nerve is going down. It has to go to the mandible, correct? So mandible is deep to this. So mandible, this is the mandibular nerve which is going to go down. Okay, so that finishes the branches of the trigeminal nerve. Now the one more foramen on the greater wing of the sphenoid, that is the foramen spinosum, into which the middle meningeal artery will enter to reach the to supply the meninges. Okay, that's another foramen. Now, so we have, by this time we have completed the cranial number 1, 2, 3, 4, 5 and 6. All right. Now that's all about the cranial nerves in the anterior sorry, the middle cranial fossa. But we have to know one more foramen here. You can see the gap here. Sorry, the gap here. This here, I already told you the Peter's part of temporal bone is actually pushing between the uh, posterior border of the greater wing of sphenoid and the body of the sphenoid. And here you have the, I already told you, you have the 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 occipital bone, that's the basic occipital bone, okay, which is not shown here. But so there's a gap here, you can make out a gap here. This gap is called as a foramen lacerum, into which the carotid artery, the internal carotid artery, will come and enter the cranial cavity. So the internal carotid artery is seen running along the carotid canal like this and reaching the foramen lacerum, then ascending up into the cranial cavity. So these are the bones in the middle cranial fossa and the foramens in the middle cranial fossa and the major important structures opening into the middle cranial fossa. Thank you.